Cyanosis is bluish discoloration of the skin and the mucosa. If there is peripheral cyanosis or acrocyanosis in the extremities only, it's quite normal in the first few days, especially in the first few hours after delivery, and this is due to the slight temperature fluctuations and vasoconstriction. However, central cyanosis is a very important danger sign. It's seen all over, especially on the lips and the tongue where it is quite easily visible. And because the babies have a high hematocrit, cyanosis gets visible quite easily as well. Central cyanosis indicates underlying cardiac or respiratory disease, and it almost always requires prompt attention and appropriate referral. We do the critical heart disease screening, which is by the saturation testing by 24 hours, and these are likely to pick up these babies before they become overtly cyanotic as well. We mentioned about the critical heart disease screening to diagnose heart disease as well, and heart disease can also be suspected when the baby has significant tachypnoea, but there is not much indrawing. The baby may be cyanotic as we discussed, and the baby may have features of heart failure like tachycardia, murmur, and hepatomegaly. The murmur may be an incidental finding, and it's also important to check the femoral pulses in these babies. Of course, the presence of the femoral pulse in the first 24-48 hours doesn't rule out a coarctation of aorta, because the PDA may still be open, and these babies may present with shock or distress after the next few days. When this presentation happens, we should think of a duct-dependent systemic circulation